escape, not so much a military tradition, but going to escape a family pathology by signing up for the military. And is that a problem that's transmitted across generations sometimes? So another good question that I don't have a good answer for. Yeah?
I was curious if you've experienced any sort of successful integration of creative therapies in your clinical work, like music or art or dance. Do they incorporate a lot of that?
Yes, sort of, is the short answer. There's some very, well, I think you've had Ralph Sirianni down here, have you not? Yeah,
I'm sure that's like a whole separate realm of the VA itself.
I didn't hear the beginning of what you just said.
I wasn't sure if it was just him, like, if that was a separate realm of the medical center, that's a whole nother, or if it's integrated on a regular basis.
I have a very positive story to tell. Certainly, you're not going to find that as integrated across programs in like a tertiary medical center like the Buffalo VA for the most part. So no, you're certainly not going to see that woven through every program. However, one very exciting thing that's happening nationwide is emphasis on psychosocial rehab and recovery models in mental health service delivery. Every hospital in the nation is supposed to have anyway, a rehab and recovery coordinator. And this brings with it a set of values that I really like, of making patients part of decision making about their care, removing the divide, the hierarchy where providers are here and patients are here. And so, for example, at the Buffalo VA, we've just constructed, I didn't have anything to do with it, but colleagues leading this have put together committees, guidance committees with veterans and advisory boards that make decisions about planning. And one of the values I like about that is a focus on functioning. It doesn't matter so much what your diagnosis or your pathology is. We're going to not set any limits on what you can do. We're going to try to maximize your functioning. And asking patients and supporting patients and taking responsibility for their own care, which is interesting. It even ends up with things like asking folks to be more responsible for their attendance, and which sounds like it's a convenience for us, but when you do that, people end up taking more charge and feeling more like what they do matters. And so I know that sounds like an indirect question, but it ends up being a much more holistic, more patient-centered approach that is also including a lot more therapies that are in line with what patients want. And there's some very cool things happening. Again, I was just talking to the head nurse on our inpatient psychiatry unit, who says, oh, it's going to be a long while more before we get everything set up, but they're doing some very exciting things. Much more recreational therapy. We even talked about, I don't think they're doing this, but we talked about how valuable it would be to have Tai Chi classes on the inpatient psychiatry unit, but they don't have, I'm sorry, I can't remember exactly what it was. It's certainly a recreational therapist, but he was doing some specific, very interesting things, maybe in the direction of music therapy. So moving in that direction, some very interesting ways. Yeah.
Also, the VAs do sponsor an annual Creative Arts Festival, and veterans of all performing arts, creative, visual arts go and share their work and get awards, and I think that then is kind of shared with the rest of the military community and the general community. So it's kind of exciting too.
Yeah. One of the, this is an indirect response to your question, but one of the things that I've enjoyed most was at the Buffalo VA, because of 9/11, the front entrance to the VA needed to be changed because it was deemed to be too big a threat. Somebody could drive a truck bomb in there and destroy the place. And so we rerouted the front entrance and made a park, and the wings of the hospital surround this front area, and made a park in there, which took 2 years to construct, but looks really nice. And last summer, as part of Black History Awareness, they scheduled a couple of jazz programs out there, and they were mostly staff and veterans, and just like 2 half-hour sets on 2 different days, and people just sort of saunter around, and it was excellent. It was they were gorgeous days and a great use of the space, and I really like the hospital as a community, but I never felt as much a sense of community among all the people there. People just sort of drift out because it pulled them in, and so I like that.